Hi, I'm Damien DeForge, and this is a teaching on chiropractic wellness. I will also go into some details of my interaction with a local chiropractor and talk some about what I learned from her. An introduction. People are more aware of their health than ever before, and they pursue wellness more assertively. There is a large proliferation of therapies that fit into the holistic and naturopathic realm of healing. This is a direction for people that are sick of just treating symptoms or dysfunction and would rather focus on enhancing function or restoring it. Innate intelligence is the theory that the body is the best healer and that its job is to help get out of the way. That's what the chiropractor does. Resistance is a term that means measuring the body's total efficiency for healing and maintaining itself at the moment. It appears to be synonymous with homeostasis and gives it a way to quantify the term. Chiropractic therapy is pretty much a panacea for any issues that stem off of concerns that it can deal with, such as subluxations and pinched nerves, etc. At the conclusion of this teaching, the learner should be able to list at least 3 benefits of chiropractic therapy, form an opinion about the most common adverse events with chiropractic therapy, explain the mechanism through which chiropractic therapy restores function, assess the potential of chiropractic therapy in their own life, and have the tools to decide if a chiropractic practitioner is well qualified or not. Chiropractors can alleviate aches and pains, musculoskeletal and spinal issues, restore range of motion, and adjust subluxation and impingements they cause. Many patients do report adverse effects from chiropractic for the short term. These complaints are such as headaches, soreness, reduced range of motion, etc. Some research has pointed to vertebral artery dissections and hemorrhagic strokes, but a larger body of research dismisses it. The chiropractor I consulted with does take these associations seriously and advises a thorough workup to screen for stroke risks before treating. Chiropractors work through the natural design of the body. The nervous system connects to all the body's parts from the brain and controls impulses transferred between them. The chiropractor works to keep these impulses flowing so that the body can use innate intelligence to maintain itself. Because of the design of the body, chiropractors can aid in many body systems so long as the causative issue is nerve impingement or spinal misalignment. So how did chiropractors come to be? Well, basically, there was a man in 1886 named Mr. Palmer, and he was a magnetic healer, and he had a patient that was a janitor that was deaf, and upon further examination, he noticed that he had a very misaligned vertebra, and he went to work on that and got it straight, and basically the guy was miraculously able to hear. So he's like, wow, I'm on to something. Let's call it chiropractic, which means working with the hands, essentially. Chiropractors do have substantial educational requirements. They, for the most part, are doctoral candidates and have gone through the first few years of traditional med school before getting specialized into chiropractic. And there is a significant growth in this field right now. Anderson and Trivieri suggests that we'll see a 17% growth in the next decade. Chiropractors. My collaborative chiropractic practitioner, as well as the resources I use, describe chiropractic as a discipline that involves freeing up the body's resources by lowering the stress of dysfunction. The process starts with a thorough health history, inquiry into the nature of the chief complaint, and a physical examination of the vertebra. A multitude of techniques are used to restore alignment. By and large, they fall into the categories of manipulation and mobilization techniques. Mobilization is described as range of motion techniques using low velocity that the patient can stop at will. Manipulation is defined as high velocity technique that the patient cannot stop at will. Lower back pain and spinal mobility are common complaints that chiropractors work on. There are also a lot of people that go to chiropractors for paresthesias, which is numbness and tingling. So I did collaborate with a community chiropractor. Her name is Janet E. Rich Myers. She was my AMP 1 and 2 teacher, coincidentally, and she was a brilliant person. Neither of us had free and easy schedule to work with, so she came up with the idea that I ask her any questions that I have via an email, and she would type them up. She also offered me a follow-up call a few days later for 40 minutes, but she was so thorough in answering the questions that I didn't feel I needed it and didn't want to take up any more of her time. I came up with a hypothetical chief complaint after doing some research and seeing that paresthesias were pretty big among the chiropractic community. So I asked Jay, which is what she likes to be called, what she would do about that. And she said she would start with a good health history and ask the patient for detail about the numbness. Next, she would do a physical assessment of the spine. Based on the area in which the odd sensation is occurring, she would have a good idea which nerve and nerve root is affected. This would allow her to hone in on the appropriate vertebra to realign the subluxation, as well as to follow its path to the offending area. She would then use various techniques to release the pressure on the nerves. This process is often ongoing for months, and it is typical that the symptoms of pain and paresthesia get worse before they resolve. As far as legal and ethical concerns with chiropractic, for starters, as I think I mentioned, there is a small amount of research that points to neck adjustments around the atlas bone as being a causative factor in hemorrhagic cerebrovascular accidents and vertebral artery dissections. A larger body of evidence seems to acknowledge that this is a possibility, but that we should be realistic about the odds, which are somewhere in the neighborhood of 1 in 1.3 million, as the likelihood that you will get a stroke from getting a neck adjustment. Aside from this generalized assertion of causation, the research connecting chiropractic to CVAs indicates that manipulation techniques are more risky than mobilization. The recommendation for these risks is to make sure patients are properly assessed for stroke risk and to make sure proper releases are obtained, consent forms, etc. Aside from these specific risks, the legal implications of chiropractic work include such things as appropriate boundaries, being respectful, offering appropriate referrals when necessary, remaining compliant with laws, insurance policies, and scope of practice. And it's pretty applicable to a healthcare practitioner in any field, I'd say. All right, advocacy, empowerment, and health promotion, i.e. health co-creation. Basically, the gist of this is, and I did get this also from Jay. I spoke to her about this one. Patients know their body the best. And chiropractors do more than just adjust subluxations. That just happens to be their main function. But they also do diet counseling, exercise assessment and planning. They discuss lifestyle factors. They encourage clients to be proactive and assertive about their health. All of these things play into the fact that society in general right now is more assertive about their own health care. Cultural considerations. Cultural factors are always a part of being a healthcare practitioner. Each person has a specific background and culture that affects their ways of interacting within the healthcare system. Sometimes this can mean difficulties with language, where repeating what you think you've understood and use of telephone translation services are paramount. Be careful that you do not make assumptions about a client because of their cultural background. So, communication is key. Don't make assumptions. Assume that just like you, everybody else has their own background and upbringing, and that's going to affect the way they use the healthcare system today. What did I learn? Conclusions. Well, I learned that the body is the best healer, and the chiropractor is there to assess what is minimizing its ability to heal and to free the body of that strain. That's sort of a bottom line with chiropractic right there. Also, the body has a natural hierarchy to its management of healing resources. This hierarchy is too complex for us to know exactly, and it changes depending on the situation. However, the chiropractor does look for ways to restore. Typically, restoring this healing status requires the chiropractor to work on realigning subluxations in various vertebrae to restore the flow of nervous impulses. Another interesting thing that I learned from Jay, there is right now an ideological divide amongst chiropractors. There are those that want to stick with the traditional, which involves the fact that it is all about innate healing and restoration of the body's ability to do its own thing. And right now, the world of insurance and managed care and all those HMO, PPO type stuff, they are all putting pressures right now that everything has to fit in a neat little box, such as listing this patient is here for a dysfunction of the lower back. Well, chiropractors don't want to treat dysfunction by and large. They want to enhance the body's ability to do what it needs to do. So that's a interesting thing. And they are also pressured not to disclose upon the dangers of overuse of pharmaceuticals and surgery, which is something that chiropractors often strongly believe in. So that's also interesting. What else? Multitudes of studies indicate that chiropractic has a high satisfaction rate among patients for its various uses. It's also safer than standard care. Anderson in Triviary goes into that a bunch. For these reasons, as well as the pursuit of general wellness, chiropractic therapy is growing at a high rate. Thanks for watching. Again, I'm Damien, and this is my presentation on chiropractic wellness.